This is the Doc Nation podcast. We are a movement founded by doctors, for doctors, dedicated to empowering medical professionals to reclaim control over healthcare decisions and advocating for their fair share of the industry's resources. Please note, the views expressed are those of Doc Nation and not necessarily those of our guests or referenced health centers.
So, Dr. Barkoh, thank you for coming on here. This is a real podcast. We love to bring in a diverse, a wide spectrum of perspectives, real people. We are very real here, attacking real issues. And when I say attacking real issues, it is in attacking them in defense and in support of physicians. That's what Doc Nation does. Right. So we do a lot of things in support of physicians, and you'll learn more about the organization as well. But today is going to be about you, your perspective, and your book. Right? There we go. That is so become a doctor, a lawyer, or engineer. Misguided advice immigrant and middle-class parents give to their children. Justin, that is that really kind of connects to us. What was that? A post that you put on social media, right? Or Betsy did.
Yeah.
About doctors maybe not advising their children going into the medical field right now.
Yeah, most parents are telling their kids, if they're a physician themselves, they're telling their kids not to go into healthcare, not to go into medicine. And it used to be 40 years ago, it used to be back in the day that you grew up and you did what your parents did. And generationally, you kind of built off of their legacy. Well, parents are telling their parents not to do it anymore. And I think maybe what you have to share with us can unpack some of what's going on or what you think about that.
No, for sure. First of all, thank you guys for having me. I'm really honored to be on. I think, as you mentioned, Neil, the advocacy that you guys are doing for doctors is really resounds with me, and I really appreciate those efforts. I will answer your question, and it's going to be not to be long-winded, but a little bit of background about myself. So I'm an orthopedic spine surgeon. I practice in Houston, Texas. I am the son of immigrants. My parents are from Ghana, West Africa. And so in a lot of ways, I lived up to kind of the quintessential calling, right? Like we made it to the U.S. We chased that American dream. I followed, kind of the advice to become a doctor. Not only did I do that, I was able to go into a highly competitive field of orthopedics and even subspecialize amongst that and spine surgery. And so for a lot of people, I'm quote unquote living the dream. And in a lot of ways I am. What really inspired me to write this book is because I felt there was a disconnect between what I was hearing in the doctor's lounges, what I was hearing talking to colleagues, and the advice that would then be given to young people who were thinking about what they wanted to do coming up, right? And to your point, a lot of people behind closed doors or to their own children were saying, hey, maybe you don't want to go into healthcare, maybe you don't want to go into medicine, but then would go speak on a panel at a college and say, hey, yeah, everybody join pre-med. And I was like, wait a minute, like you're not giving them the full spectrum, the full story. So the goal, the mission of the book is to provide informed consent for career decision-making. And what I mean by that is that as a spine surgeon, before I do a procedure, before I do a surgery, I have to give the patient informed consent. And so that means that I have to explain to them the procedure, what I'm going to do in words or in a way that they would be able to understand and internalize that. I have to explain to them the risks, the benefits, and the alternatives, including not having the procedure, right? And so then after I do all those things, if they still want to proceed, they've been informed, they can then give me their consent to proceed with the surgery. And so my goal for the book was to provide the same thing. Hey, I know you've heard that you should grow up and you should want to be a doctor, lawyer, or engineer, and for a lot of people, doctor is kind of the pinnacle or the highest of that ranking. But before you do so, let me tell you the ins, the outs, the good, the bad, and provide some tools for maybe you to have a little bit of introspection. What are your goals? What are your passions or purpose? And then if you still decide to do it, great. I support you 100%. If not, then okay, well, hey, here's some tools to maybe evaluate yourself and evaluate what your interests are and maybe find out where your passion truly lies.
Can I flip into this book a little bit without giving up too much? Can I flip into the book a little bit?
Yeah, please do.
What are the big watch outs, or what are the downsides of not reading the book and not getting this informed consent?
Yeah, I mean, I think that the downsides are like anything, if you don't know what you're getting into, there's a higher chance that there could be some disappointments or frustrations, right? Or even regrets, right? And so you see that in the surgery world. And so I talk about that a little bit in the book. I give an example. You know, you have a patient who comes in and they have a history of having some intermittent low back pain, but all of a sudden one day they're you know, pulling weeds in the yard, and they immediately get some burning pain shooting down their leg or have some sciatica that develops, right?
Mhm.
They come into the office, you get an MRI, you see they have a herniated disc at L5S1, you tell them, hey, you've got a herniated disc. If we shave down that herniated disc, that'll fix the problem. They say, great, they sign up for it. You do the surgery. You see the patient back maybe 2 weeks or 6 weeks after the surgery. You can tell that they're not completely happy, right? So you ask them, hey, what's going on? You know, we cured your leg pain. And sometimes you'll hear back from the patient, yeah, you cured my leg pain, but my back still hurts. Or what happened there? What happened there was a disconnect, right, between the patient's
Yeah.
expectations and the surgeon's expectations. They weren't on the same page before they went into it. And so same thing can happen from a career perspective. If you don't know what you're getting into, you don't know the pros, the cons, the risks, the benefits, there's a lot higher chance that you might be frustrated on the back end. And I think you see that if you look at the statistics for physician burnout, if you look at the statistics for even physician suicide, right? There's a lot of people who are dissatisfied. And I think, you know, that's multifactorial, but one of those components is that disconnect or that dissatisfaction between expectations and reality.
Tell us about why you chose your path. Why did you become a surgeon?
Yeah, so a lot of the influences that I talk about. So, you know, my parents were more indirect than direct with their advice on becoming a doctor, but you knew just by the way they spoke about other doctors or family members who were doctors, you knew that they valued that career path. And so,
Yeah.
you know, you want to please your parents, you want to honor them for all the sacrifice that they've done, even to get us to this country, right? And
Yeah.
so early on, that was kind of the push. I also, you know, I did well in the sciences. So, you know, I enjoyed doing the science classes. So I was like, okay, that's a good fit. And then, you know, as an orthopod, kind of typical orthopedic jock story, right? I was an athlete. And so it was like, okay, well, I can stick around sports with orthopedics. And so it's kind of the merger of all those three things that pushed me to go into medicine and then also into orthopedics. And then I gave up sports and ended up doing spine, but that was kind of the genesis of it all.
Awesome.
You have a really awesome story. I think you're going to help a lot of people with the book as well. When is it available?
So it is available October 1st, and it's going to be exclusively through Amazon. And that's the paperback version. You can start to pre-order the Kindle version now, but everything will be live October 1st.
What are you
Is
aiming
this
to
your
achieve? Yeah, what are you hoping to achieve with the book? What's the outcome you're wanting?
Yeah, that's a great question. So step one, as I said, is just that informed consent process. So helping people see both sides of the argument. There's some concepts that I kind of explore in the book. I present my theory of wealth relativity in the book. We talk a little bit about wealth. We talk a little bit about passion, purpose, goal setting. And then there's also a chapter in there where you just don't have to take my word for it. It's a chapter where it's a series of interviews with other people in healthcare and engineering and law, and you can get other perspectives on it. So step one is just to give people the space to be curious. To be curious about whether or not this is the right advice for them, right? That's step one. And then step two is an ongoing project that I'm hoping to develop. So my wife, her background is in student affairs and higher education and assessment. So step two is our goal is to put together a platform for people to kind of learn more about themselves, learn more about their emotional intelligence, see what kind of career paths fit for them. So that's phase two. That's the ongoing part of the project. But really, the goal
Yeah,
is just trying to help connecting people with their passion and purpose. And if we can, you know, even help one person do that, then I think the book was a success.
awesome.
like that? I think not being a physician, one of the biggest fears I have when I hear some of these topics is like that we're going to have a big physician shortage, right?
Yeah,
Like,
I don't think so. I mean, I don't think there'll be, well, I mean, you know, statistically, the projections, there's already projections of physician shortages, right? So that's a whole problem in and of itself that needs to be combated. What I'm trying to prevent is adding to that shortage by people leaving the fields, right? right? And there's different ways
Yeah.
people exit. People exit to go do other things. People exit, during training. Unfortunately, some people are exiting from suicide, as we talked about, or substance abuse. So what I'm trying to prevent is people exiting and contributing to that shortage, mainly because they weren't compatible with it in the first place, right? If your main motivation for becoming a doctor is trying to please your parents, I I think that you're going to end up disappointed. I think you're going to end up frustrated. I think you're going to end up burnt out because there's a lot of burdens that come with the job that if you don't truly have a passion for it, it's going to be hard to deal with those challenges.
Yeah. That makes
Burdens
sense.
of the job.
Yes.
What's the number one burden right now for you? Or
Um,
you can even generalize that one if
Yeah,
you
I
want.
mean, I don't know if I'd give you rank order, but I'll give you a couple. I think one is the financial structure of it, and for that, I mean, dealing with insurance companies, if you're in the private world, or dealing with hospitals or private equity, if you're in an employed model, that always leads to clashes and frustrations because it's a barrier to what you came here for, right? You came here to take care of patients. That's a huge barrier in between you getting to do what you want to do. There's not a week that goes by that I'm not having a conversation with a patient that's miserable. They come to my office, they're in agony, right? And they've got a clear problem that we see on the MRI and say, hey, I want to fix this for you, but first you have to do X, Y, and Z because the insurance company requires you to have at least 6 weeks of supervised physical therapy. And we have to try one injection. And they're like, doc, that's expensive. Every time I show up to the physical therapist, I have to pay a copay. Why can't we just fix it? And I'm like, yeah, I want to fix it for you, but this is what's stipulated by the insurance companies. And that's frustrating, right?
Yeah.
So that's one major frustration. The other burden I would say is kind of the malpractice environment. That that's a black cloud. I mean, even if you win the lawsuit, right? That's years of time that goes into defending that and dealing with lawyers and just worry. It causes you to second guess your decision making going forward. So that's another huge burden. And so all those things can kind of add additional stresses on top of just trying to do right by people, right? That's a stress in and of itself. As a surgeon, I had a mentor tell me once, if you don't have any complications, you're not operating enough. Right. And so initially when you hear that, you kind of taken aback. What do you mean? But the statistics, if just for hypothetically speaking, if the risk of infection for a procedure is 1%, if you do 300 surgeries,
Yeah.
you're gonna have 3 infections. And
Yeah.
that's with
Yeah.
doing everything right. That's
Yeah.
you sterilize instruments, you sterilize the patient, they get antibiotics beforehand, afterwards. Everybody uses sterile technique. You know, somebody's going to get an infection, and that's a burden too. To somebody who came to you for relief, you're trying to help, now has a complication, now has other challenges that you're dealing with. So there's all sorts of things that we take with us as physicians, as providers, that you have to deal with. And again, if you're not in it for the love of doing it, if you don't have a passion for doing it, if you're doing it because you're trying to please other people, I think that can sometimes be too heavy a burden to bear.
The theme of what you just shared, I heard, and maybe this is unintentional, I don't know, but the problems that you face or the burdens that exist have nothing to do with the actual providing care to the patient.
Right.
It's everything else around it. It's the insurance company, it's the business, it's the private equity, it's the employer, it's all these other things. I think that's what's frustrating and unfortunate about this is that you want to change lives, you want to help people get out of pain, get back to mobility, and the number one problem is everything else that's trying to interfere with what you're doing to do your best to take care of people and to get them back as close to 100% as possible.
That's
So,
that's very accurate assessment for sure. And I mean, I think, in today's environment, there's no way of getting around that. I mean, there's a small subset of doctors who have like a direct care or a cash pay model.
yeah, right.
But for the majority of people out there, that's not really a tenable model, right? Most people expect to use their health insurance to pay for most of their medical expenses. They've already paid for it, right? I've already
Right.
paid into this. I want to
Prepay,
use
yeah.
this.
Totally, yeah.
And so, and then certain things, you know, like in my subspecialty, for instance, certain things are cost prohibitive. You know, to have a spine surgery is really expensive. And most people, you know, if the average American struggles to cover a $500 or $1,000 emergency expense, to say, hey, 25, 30, 50,000 expense
Yeah.
for a surgery, that's
Yeah.
going to be unattainable. So so I wish you could get rid of some of these factors completely. I don't think in the current environment you can. And so again, to your point, you one of the things, and one of the reasons I think the book is important is because we need to have conversations about this, right? You need to know that
Yeah.
it's not just you and the patient. There are these other parties that are going to be in the room, and you got to be willing to deal with that, right? You're going to got to be willing to navigate that. To get to your ultimate goal of taking care of patients, you got to be willing to navigate that. And so that's what, you know, we touch on that a little bit in the book as well.
And so the goal is to make it better for physicians and improve medicine and healthcare, but doctors need to know what the reality is right now and what they're
Correct.
signing up for.
Yeah. What are the obstacles?
Correct.
Yeah.
Correct.
I knew that you and Justin were going to be friends, by the way. Like, you
For sure, for sure. No, I mean, I think one of the anecdotes that I put in the book, when I was in undergrad, I went to Texas A&M for undergrad, and I was in the honors program, and so there were different tracks or options that you could take. And one track was like you took a bunch of honors courses in one discipline in the sciences. The other was you took a bunch of honors classes in different specialties. So I wanted to do that. I was like, well, let me try to broaden my horizons. And so
Sure.
my worst subject by far is math. Like I'm not a math guy. You know, I'm the guy who's pulling out the iPhone to plug in stuff to do. That's me. I'm not a
Okay.
math guy. So, when I had came to taking an honors math course, I was a little bit afraid because I'd tested out a like freshman calculus. I was like, man, I can either take an upper level calculus or physics or find something else. So I found that I could get that honors credit for math by taking a logic course. And so my professor in logic was super passionate about logic. Like he was amazing. He made learning amazing. And so I got to know him, and I found out like he was actually pre-med in undergrad.
Okay.
And he had gone into it for the wrong reasons. He was trying to please other people. People told him that's what he should do. And he got to his fourth year of medical school. He was like, this is not for me. And so that's a huge dilemma. What do? You've already invested all this time, you've invested all this money, but you know in your heart that you're not happy. For him, he had the courage to walk away. And so he left and ended up going back to grad school, got a PhD in logic. And the passion just exuded from him when you were in his class. You knew that he cared about what he was doing. And that's beautiful, right? And that's what I'm hoping that book can help people do. Just stop for a moment and have that conversation with yourself. Is this truly what I want to do, where I want to be? Or is there something else out there for me? And for him, he's still helping people. I feel like he really helped me, not only specifically in that class, but just the conversations that we had in his office when I was going for office hours, things like that. He really helped me. So there's other ways to help people. There's other ways to be useful to society other than what people kind of peg as what's important, or only the things that are important.
I would love to segue into the math and how that your lack of desire or interest, or well, you talk about wealth in your book. I know that's
Yes,
not necessarily the focus of our conversation here,
correct.
but maybe at another time we could talk about trading time for money, passive income, building wealth, and doctors are in a struggle where that's a reality. So maybe that could be another topic for another day. But what
No,
would you say? What would you say for your viewpoint? You have a perspective. You've been in this arena for long enough now. What would you like to see change? What's some of the low-hanging fruit or things that surround your practice that by tweaking this or that could bring impactful change to the burden that's around you trying to take care of patients? Do you have any thoughts on that you can share with us?
Yeah, absolutely. There's been some thoughts about this, or some inroads to this. So there's a program. It's like a gold card program, essentially. So if you are a provider that are practicing evidence-based medicine, you're conservative, and a certain percentage of your procedures that you submit for or tests that you permit for get approved, then you can kind of bypass some of this prior authorization process for some things.
Yeah,
I think
yeah,
the more things like that would be great, you know.
yeah.
if you're somebody who's reasonable and conservative and you say, hey, this patient needs an MRI, it shouldn't take 3 weeks and 2 peer-to-peers in order for me to get this MRI for the patient, right? So more barriers to access like that, I think would be great. I think more business education and training, I think would be important. We get none of
For
it.
who? For doctors?
For doctors. Yeah.
Okay.
We get almost nothing. I think towards the end of med school, we had one like brief lecture on like, hey, this is how you manage debt. But at that point, everybody was like hundreds of $1,000s in there, like, oh, this is a little late, So,
Yeah.
so I think education around how to run a practice, how to run a business, finances and debt is super important. Because I think the more and I'm biased in a sense. Let me just tell your audience out there, I'm in private practice. So I think the more people who can stay independent and be private, the better healthcare will be. I think
Why is
as
that?
some of
Help them know why. Tell me more about that.
Yeah, I think as healthcare becomes consolidated and it's more business people who have no healthcare background or training or education that are running things, they miss out on the human factor and the art side. So people always say healthcare medicine is not just science, there's art to it, there's nuance there. And so if you're just a Excel spreadsheet number person, you miss out on that. I worked for HCA hospital system for a couple of years, and I would tell you, that's what you see when you run it. It's not, hey, what's going to make the patient's experience better, so to speak. It's, hey, how do we increase revenue sometimes, right? And so if when you're trying to say, well, hey, let's get one more person to answer phones because people are having to call back multiple times, or we're missing things, or it's taking too long to get their prescriptions refilled because we don't have enough people on the phones. That's not always their priority if you're just looking at it from a pure business standpoint, right? And so a lot of times those things can provide frustrations and barriers to quality care, right? It's not always about, profits at the end of the day.
Yeah. Love that.
And if I could briefly touch on, I know we have a hard stop coming up. If I could briefly touch on the wealth thing.
Yeah, please.
Yes. So I'm not a numbers person, but I talk a lot about wealth in the book. So there's two chapters, one that's called The Theory of Wealth Relativity. The second one's on wealth. And so briefly, the theory of wealth relativity, again, not a math guy. I had to consult physics for dummies to write that chapter, but it talks about the theory of relativity. And so there's Galileo, famous physicist. He has the Galilean principle of relativity. So it was talking about laws of mechanics. And if you're looking at uniform motion, so it's speed, motion along a certain plane, you can only understand it based on a frame of reference. And so that's the whole analogy. When I was on the plane flying up here, I'm in Chicago right now. When I was flying up to Chicago, if you asked me how fast I was moving while I was on the plane, well, relative to the ground, right, we're cruising at 300 miles per hour. Relative to the person sitting next to me, I wasn't moving at all, right? And so wealth a lot of times is the same way. You can't really understand it unless you have a frame of reference. And so a lot of times when people are advising their children, hey, become a doctor, lawyer, engineer because you're going to be wealthy, you got to understand the frame of reference that they're looking at these careers from, right? And so in the book, I talk about, the reality is if you're making $100, $200, $300,000 a year, while that might sound like a lot of money, in some ways it is, that doesn't make you automatically wealthy. To the point that you made in the next chapter, as we talk about wealth, I define wealth as being able to do what you want, when you want, where you want, with who you want, while you still have your health. And so that's a different definition. To your point. That's no longer the trading time for money definition, right? It's being in control of your time, because that's the most limited asset that you have, right? And not only is it the most limited asset that you have, you don't know how much of it you have when you're on the day that you're born, And so because of that thing, because of that scarcity and because of that unknown, time then moves into this time slot, into the slot of the most cherished commodity that you have. So being able to control that's really, really what it's about. So no, I agree with you. Understanding these concepts are really important, and that's why I touch on that early in the book. To your point, not because wealth is what it's all about, but you have to kind of unpack the misinformation that's around there about these careers and why it is what it is, and then you can move into understanding, okay, what am I about? What are my goals? What is my passion? What's my purpose? And then defining that for myself.
That's so well said.
Yeah,
I feel like that's a podcast part 2 that we need to get.
Yeah,
For sure.
so accurate.
For sure. For sure, for
Yeah.
sure, for
How
sure.
much
So
of
thank
that's
you. I mean,
being, yeah, how much
yeah,
of that's being shared in the school systems, at home with, parents to kids. It's a very rare thing to hear what you just said. It's
it's
not.
not. And a lot of times, sorry to cut you off. I mean, a lot
Sure.
of times people's fear is that, when you start talking about money, talking about numbers like that, the fear is that you're going to get crucified, right? In this social media era that we're in, you get a doctor, as soon as this book drops, I know people are going to be coming from me. Oh, you're a spine surgeon. What are you complaining about? Like, you're doing
Yeah.
fine. It's not a complaint. It's not, I am blessed in my life. My family's good. I'm good. That's not what I'm saying. I'm saying that you got to understand where these concepts come from, right? Because that context provides the clarity for you to then make the right decision for yourself. So that's all I'm really trying to do. I just want to provide that context for people so they can make the right decision for themselves.
Oh, I have no doubt that if fame comes with this book, and it probably will, it'll be the right kind of famous because you're trying to help people. And I
Exactly.
really,
Thank
really
you.
love that about you.
Thank you
Um,
very much.
I also want to say this, like your logics professor, you can see and hear your passion for medicine and for helping your colleagues, your peers. So I think your parents did get it right, though.
I do
No, for
too.
sure. Yeah, I mean, like I said, we can't reveal too much. Still want people to get out there. My new book, October 1st on Amazon, but that's the last chapter. So the question that I get a lot when I have these conversations with people, it always ends on, well, would you do it again, right? Or would you do it differently? What would you do? And so the last chapter of the book is called The Decision. And so that's where I kind of unpack some of those things. So a little foreshadowing, a little cliffhanger there. You guys pick
Oh,
it up,
yeah.
check it
That's
out.
a little bit like LeBron James there, right? A little
Love
bit.
it.
It is like LeBron. So there's a lot of
Good.
cultural references in the book because I want it to be approachable for a wide range of people. I want young people to gravitate to it, older people. So yeah, in that chapter I do talk about the LeBron's decision as a segue into my decision. So
That's awesome. Well, I look forward to getting my hands on the book.
Me
Yeah.
too.
thank you. Thank you. Thank you. I'll show the cover again for all the people out there. Yeah, check it out. October 1st. It's on Amazon. Become a doctor, lawyer, or engineer. Misguided advice of immigrant and middle-class parents. I really hope it helps people. I thank you guys for the opportunity, for the platform to kind of share a little bit about it. And hopefully, like I said, yeah, let's do a part 2. We'll come back and we'll talk about more stuff for sure.
I'm super excited for you. Thank you for your time today.
Yeah, thank you.
Absolutely. Absolutely. All right. Thanks, guys.
Thank you.
This has been the Doc Nation podcast. If you like what you heard, be sure to subscribe, rate, and leave us a review on Apple Podcasts, Spotify, or wherever you are listening to us. Your feedback really helps us reach more listeners like you. We'd also love to hear your thoughts and any topics you'd like us to cover in future episodes. Don't forget to follow us on Facebook, Instagram, and LinkedIn for updates, behind-the-scenes content, and to join the conversation. Thanks for listening.